My name's Joanne Jones and I'd like to tell you my story. Now, I'm 30 years old and I've recently been diagnosed with a secondary breast cancer and bone cancer. Now, you should watch this film because it might just save your life. And it's just a short one, just to let you know what's going on. Now, this began earlier on in the year when I was misdiagnosed, just like Kylie originally. I was out of breath. I went to the doctors and they told me I had asthma. The second GP, then a few weeks later, again told me I had asthma. Finally, I couldn't breathe, so I went to A&E. Now, the triage nurse, the lady who first saw me, said, "Oh no, you really shouldn't be here. This is an issue for your GP. But I'll let you see a doctor." I nearly left at that point, but thankfully my mum encouraged me to stay. So I saw an excellent doctor who gave me a very thorough exam. And he pointed out that the out-of-breath symptom was because I had 2 litres of fluid on my right lung, and that was a side effect of the breast cancer which had returned, and he'd found a lump in my right breast. He could have knocked me down with a feather. I was completely stunned. I'd had breast cancer in 2002. I'd had a lump removed. I'd had chemotherapy and radiotherapy. I was only 24 at the time. But I hadn't given it a second thought since I'd received the all clear. And last year, I'd had my 5 years all clear. So I really thought I was out of the woods, you might say. But it turns out that I'm not. I've got lumps in both breasts, and I have the bone cancer to contend with. Now, up until earlier this year, my life was perfect. I have a wonderful husband and a beautiful 1-year-old daughter, and we were trying again for our second baby. Early on, just after I'd been to A&E, I found out that I was actually pregnant again. So before I could actually start treatment, I needed to have a termination, which is as sad as it could be. That was one of the most horrible things I've experienced so far. That actually the process was delayed. My diagnosis was delayed because I wasn't able to have a CT scan or a nuclear bone scan until the pregnancy had been dealt with. And it just turned out that I happened to be in the hospital at half-term when 3 senior consultants, all of whom could help me sign a consent form to say that I could go ahead with these scans, were actually on holiday, which was very nice for them. And I don't begrudge doctors going on holiday, but I begrudge 3 important officials going on holiday all at the same time. That meant that the process of diagnosis was delayed by 2 weeks. Finally, I was able to have a termination. Sadly, the first medical termination, which is done with tablets, didn't work. The second one didn't work again. And so finally I had to have the operation to clear out my womb and finally end that pregnancy. That was the day before I had my first dose of chemotherapy. Now, during this time, I've had my chest drained 4 times. That's when they stick a tube into your lung, or into the outer area of your lung, between the lung and the skin that kind of lines the lung, to have the fluid drained off, which has been another horrible experience. I've had to be part of for my family to do that. The whole thing has been pretty horrendous. I'm making this film because I want people to know that it affects your average Joe. I'm 30 years old and no one would have suspected. But are all women checking their breasts, even from their early 20s? Because they should be. Are men checking their testicles? Are people going to the doctor as soon as they get any sort of sign that they're unwell? Because they should be. Maybe if I'd gone to the doctor before Christmas, when my breathlessness started, maybe the cancer wouldn't have had a chance to travel to my bones. Maybe I wouldn't have started trying for a baby, and I wouldn't have had to go through the horrible, horrible process of termination. Now, I want someone to help me make a documentary. I want someone to help me document my experiences. Look, my hair's coming out. It's coming out in big handfuls. It's not pretty. It's going to go. I'm going to get it shaved. And soon I'll have to have both my breasts removed. That's my choice. I want to make sure that I can eliminate this cancer. I'm going to be one of the miraculous recoveries, and I want you to help me document it. So, this is my story. It's harrowing, it's cancer, and it touches 1 in 3 people's lives. Those are the statistics. So I want to tell you my story, warts and all. I want to tell you all about it. I need you to help me make a documentary to save people's lives so that something good can come of my horrible tragedy. There's more, there's so much more I can tell you about the NHS system and the bureaucracy that's involved in trying to get in for treatment, and sadly the miscommunication between departments, and the difficulties in piecing together all of the different elements that you suffer when you're suffering from cancer, and the different symptoms and side effects that happen. The chemotherapy is horrible and it's hard, but I'm going to beat it. I'm going to beat this thing. I've got another 5 doses of chemo, 1 every 3 weeks to contend with. Then I'll have surgery, and then they'll be dealing with my bone cancer after that. There's lots to do, but I'm going to do it. I need you to help. So please phone me up, give me a call, come to my home, and next time you see me, I'll be very, very bald. But not to worry, I hope you can meet my family as well. Sadly, my little sister, who's now 23, has had 2 bouts of cancer herself, leukemia and a brain tumour when she was 10. My family have had a lot to contend with. We've got a big story to tell, but we hope it will help people, and we hope it will help our recovery to know that we've done something good in the world, that maybe we can make a difference. Please help me. Joanne Jones, that's my name. So give me a call. Thank you.